thanks for asking that. It is. And the first thing, it is common. And the first thing I would say to that is not without good reason. Well, we have a terrible history, right? I mean, the history of treating addiction in this country first looked like treating people who had alcohol use disorder with cocaine back in the 30s, right? Well, that was lovely. They stopped drinking, God knows, but they had a whole other problem. And that is, there is valid concern there. And we know that even with methadone, the most common, as you say, agonist therapy, people can overdose, people can use it and get high, and they can continue to use it similar to how they would use illegal substances. That does happen. I will say, though, buprenorphine being a partial agonist and not a full agonist, buprenorphine, again, the active ingredient in Suboxone, that's a different playing field. You literally cannot overdose on buprenorphine alone. It is not possible. Now, of course, you can overdose if other things are in your system too, but even people who are opiate naive, who've never taken an opiate before, and who may say they get a feeling of euphoria or feeling that high feeling from buprenorphine, initially will find that if they keep taking it, they don't keep getting higher and higher and higher. That there is that ceiling effect with buprenorphine that makes it, in my opinion, safer at some points than methadone. Although, be clear, methadone saves lives every day, and I'm a total proponent of methadone treatment as well. But what I would say to people who have that concern is, rather than making a judgment about an entire type of treatment, let's look at every individual who's benefiting or not from that treatment. And let's ask ourselves one question: are they better off or not? And the doctors that I talk to have studies upon studies upon studies that globally, from a public health perspective, will show you that flat out, less people die on medication-assisted treatment or medication for addiction treatment. We've moved to calling it that, medication for addiction treatment, because we find that that's less stigmatizing than medication-assisted treatment. It's not assisted. It's just like medication for anything else. Anyway, less people die, plain and simple. So that, to me, is undeniable facts. But then beyond that, beyond overdose, maybe somebody who's overdose prevention, maybe somebody who's taking medication for addiction treatment on buprenorphine for years and years and years, right? Still, I ask you, is that person working a full-time job? Is that person using less other substances? Is that person overall happier in their life? If they are, what are we doing? Let's not change a thing. Obviously, we're doing something that's working for them with low risk, right? So I support people getting off of buprenorphine when they have, repaired their life and are in long-term recovery. But I also support some people in staying on it for years and years and years. Again, if their life is working and they're functioning better in their life, who are we to judge what's going on for them? Is it not working? Then we need to look at something else. But the idea behind medications for addiction treatment is that they improve the overall quality of someone's life. And if that's happening, who are we to judge that they're doing it the wrong way?